Ambulance service. Is the patient breathing?
We're back on the front line.
We're sort of better mobilised.
Following Scotland's paramedics.
Top floor fire in a block of 4.
Got an 80-year-old female who's fallen outside.
He's been stabbed. Is the attacker still nearby?
I need you to say the word now every time her chest rises.
Every day, they save lives.
Hi there.
We're the first people that people see when life can get quite desperate.
You're okay, you're not going to fall?
You sure?
100%.
And every day, they face new challenges.
Oh, they were going in with shields.
We're expected to dip into everything: mental health, trauma, medical.
But now we're being stretched even further.
Unbelievable.
Listen, I can understand you without swearing.
I laugh in the face of danger.
Sometimes you're seeing people at their absolute worst.
You're fine. You're fine. Listen, you're in safe hands now, all right?
At the end of every shift, I can go home knowing that I've made a bit of a difference.
This is Scotland's ambulance service, serving over 5 million people in every corner of the country. This time, we're with crews in Oban, Inverness and Linwood.
Go ahead.
The major incident type of incident is a house fire. It appears to be a floor in the block dwelling. The top floor flat appears to be on fire at the moment.
It was the beginning of a night shift, so it was reasonably early in the evening, maybe an hour or so in.
Hazard at present, so smoke, it's a bit wet with the water. There's also firefighting activities ongoing and fire still ongoing within the property itself.
The fire service was actively fighting the fire at that time, so that gave us the information that this is more than just be it a small kitchen fire, and it does mean that they're potentially putting people into the property and that the fire is well established.
Number of casualties at present, we're unsure. Number of casualties. As I say, still an ongoing incident. Unsure if everybody's accounted for at present.
We don't get masses of information initially from the fire service. We just get the information whether there's a person reported within the dwelling. Generally, most private properties will come through to us as being a person reported, which means there's potential or a likelihood that there is someone in the property.
498 control.
They're generally really busy to begin with, so trying to get a word with the fire service.
One being brought out by fire at the moment, unsure of the condition, property as soon as we can.
So that's one person being taken out of the property now, condition unknown.
The fire is in Paisley, 5 miles from base. Multiple SORT resources are now on their way.
So we deployed 3 vehicles initially, so send as many as we can. Obviously it's easier to descale it and stand people down once there, as opposed to stand people up once we're already on scene.
Just advise I'm also on my way.
Yeah, Roger just had that over the talk. That's us on scene.
Yes, mate.
It was obviously well-established fire. I think the fact that the fire itself was in the roof space, being that it was the first floor, it was given quite a lot of fuel from the structure of the roof. Approaching anything like that, you generally do get slightly tunnel visioned into what you're trying to do, which is find the patient, if there is one, and give them the best possible treatment at that time.
Property is well alight now into the roof area. We have one patient who is in cardiac arrest. No other patients given at this time.
There was a divisional crew already on scene at the front of the building, so the patient was brought to them initially.
The patient is in a critical condition and has to be treated in the front garden of the burning house.
When we arrived, there was no specific danger within that front garden while we were treating the patient. But with the heat increasing in the flat above, the first thing to go was the window. So the heat blows the window out into the garden.
You're gonna have to get your helmet on because I just got whacked in the face.
So automatically you're thinking this is not a safe place to go, even before the slates and the roof began to sort of disintegrate above us.
Get your helmet. I'll get this, get your helmet.
The glass gave way in the top flat, so that noise led me to look up to see what was happening, and there was a slate that caught me just to the side of the chin. It wasn't particularly big, I wasn't injured in any way. A bit of a mistake on my part, I suppose.
Josh, can you grab a scoop and we'll get this patient away from the roof?
Go ahead.
We're going to get her moved and work on it. We're just going to get our thumper up and running so we've got CPR on going.
The patient's heart has now stopped beating.
That definitely wasn't the place that we wanted to perform CPR. But the importance of maintaining good CPR once it's started to increase the patient's potential for recovery is essential.
As they are trying to save the patient's life, the crew are given worrying news.
Once advanced life support was being provided for the first occupant of the property that was brought to us, we were advised by Scottish Fire and Rescue Service that they'd found a room with toys. They're thinking that there was potential that there may be children within the property.
It's only an assumption, but I'm based on the fact that a female alone, kid stuff in the hoods.
Yeah, she's in pyjamas, so there's no ID on her whatsoever.
Yeah, that's right. What do you mean? Well, we got the police and see.
The woman was in cardiac arrest when she's being pulled out. Obviously not too sure of the condition of her at the minute, so just waiting for an update. We've got lift guys in the back working with her, so she's got the best team there, but unsure at the minute how that's going to go. Don't know if there's any more patients going to be recalled from the scene as yet, so just waiting out.
Hello, ambulance service. Is the patient breathing? Sorry, caller. Caller, is the patient breathing? Is the patient breathing? He's been stabbed. Okay. Answering these questions will not delay any help, okay? But we do need to ask them, okay? And just to confirm, is he conscious? He's conscious just now, okay. All right. A stabbing call is always a frantic, chaotic call. And is the attacker still nearby? A stabbing's not something you come across every day, so, you know, your average person, if somebody gets stabbed near you, you wouldn't know what to do. Okay, and is there any serious bleeding? Of course, okay, all right. Is he responding? Okay. And what part of the body is injured? His belly. There's multiple things to take into consideration with a stabbing. We have to consider scene safety. Okay, and is there more than one wound? This patient's been stabbed. Is the attacker still nearby? Are they still hanging around? Are they likely to come again? Are they likely to attack the crew if the crew arrive there to help? Okay, no, you're fine. No, that's okay, that's all right. Is there more than one wound? With an injury like this, there's obviously instructions that we need to be able to relay to them. They're not always that easy to do when somebody's so upset or so, panicked or irate at the certain situations, so. Now, is the object still in the wound that you're aware of? Okay, all right. And are you right by the patient? Okay. Okay, and you've got children there with you. They're not with the patient, they're with you. If the attacker's still nearby, children absolutely need to be out of the way, and they need to be out of the way fast. But also, with children are reactive to adults. So if they are around a group of adults who are in this very chaotic, very panicked, mayhem of a scene, it's not good for them. They're then also going to be a part of this chaos. That's okay, not to worry. Okay, so help has been arranged for him, all right. Okay, now if you get any more information, anything changes, you call us back immediately on 999, okay? All right, you're welcome. You take care now, okay? Ron?
But now Roxanne has a problem. Because the caller has left the scene with the children, she cannot be sure the patient is getting first aid. She calls for help from her supervisor.
It is the stabbing, yeah. So I came off the phone to my caller because she had young children with her and they were quite hysterical. So she moved away from the patient, so I was unable to give bleeding control instructions and things like that. Are you able to just double check there's somebody on the scene that is giving instructions?
I'll have a double check.
There's always so much going on those calls.
There seem to be 2 or 3 calls come in, but they all seem to come off it. So I don't know if you want to try to call it back just to see if they might be engaged. Because the last call came in about 3 minutes ago, but there's nobody on it.
Hi there. I'm ever so sorry to phone you back. I'm just wondering, are you able to tell me, please, is there anybody there with the patient that is... Right, okay, and are they administering first aid? Right, okay, that's fine. Right, okay, that is fine, not to worry. Okay, I'll just pop that there that the police are on scene with them. All right, thank you very much. No problem, thank you. Ron, police had just arrived on scene, and then as the call ended, our ambulance crew arrived on scene as well.
Special Operations paramedics Josh and Daniel have been on scene at a serious house fire for 30 minutes.
Got one patient, cardiac arrest, believe top floor flat. Actively obviously fighting the fire in the roof. There's already smoke and heat ingress right along the multiple roofs.
One patient is receiving CPR, and the emergency services are worried there may be children still inside the building.
The flames then managed to spread full length of the building, and the whole roof was burning at that point. So it did progress pretty fast. That was in probably 30 minutes from us getting there. The whole roof was on fire.
Yeah, that's the shit. I'm just getting there. I'll make my way. Yeah, what's that?
Safety-wise, you trust your fire colleagues implicitly that they are there to keep everyone as safe as possible. As much as it looks very dramatic, as long as you are aware of your own safety as best you can, it's not something that we're particularly frightened of or fear as such. You just have to treat it with the respect that it deserves.
The fire service have had to pull back from a second room due to the ceiling coming in. There is evidence of children's stuff within that room, so they're working under the assumption that it's a kiddies room. But they don't expect to pull anyone alive out of that room. It's their thinking just now. It's pretty much where we are.
We were thankfully given information from the police that any potential children within the property weren't there that night. They were staying with, I believe, their father or another relative. So at that point, fire service had made a decision once the full building was evacuated and that there was no potential for any further people within the property, that the safest form of firefighting would be from high reach appliances up into the roof space.
Once the fire's been contained, there'll be hours and hours of damping down and investigating into potential cause and sweeping all the area that they've not been able to get into due to the ferocity of the fire. So it's going to be an all-nighter for the fire service, and we'll be pretty much supporting them, maybe not in the same numbers we have now, but we will be supporting them through the evening in that.
So unfortunately, the first patient and only patient that was removed from the property, despite all our best efforts and receiving a full sort of 20 minutes of advanced life support, unfortunately, there was nothing more we could do, and that patient was pronounced life extinct while still on scene. I think for all people in any ambulance service, it's a case of knowing that you have done everything you possibly could, so that you're not left with any doubt that any patient wasn't given the best possible chance. In this particular incident, I don't think the nature of the fire and what happened was survivable, unfortunately.
Sorry, I'm just going to divert you onto a raid call in Paisley. I've got a single para on scene as the first response.
Yeah, I'll see, no problem. That's a nurse looking for 28. I don't know if that's a member of staff. I think that'll be a member of staff.
Collapse injury. 4 months pregnant, assaulted by resident. Resident struck her in the belly. So a red call is what we class as an immediate life-threatening call, so it's the kind of second top call that we have for emergency. So it starts at yellow, then goes to amber, red, and then purple. Purple being the kind of top emergency. So it is something that is needing an emergency response and is very serious.
So because she's 4 months, she's going to have had a 12-week scan, so she'll be under the midwives at Paisley, I think. We'll take our guidance for them, we'll phone them and see what we've got. It's going to be quite worrying for her, isn't it? This lady was 18 weeks pregnant with twins. She had been unintentionally assaulted by a resident with dementia. Initially what you're thinking, the concern isn't necessarily for the mother, it's the concern for the twins. There's no way for us pre-hospital to say if the twins are okay. Hello there, how's things? You alright?
This is Phoebe.
Phoebe, you alright, darling? How you doing? Alright, I'm Pete, that's Kyle, alright? How's happening?
Are you sore just now, Phoebe? Yeah, okay.
Listen, you're safe hands, alright? Are you waving at them? Alright?
The woman is quite distressed at the time. She's obviously landed on a bump, she's feeling pain, she's obviously worried about our children inside her. Is it your hip that's sore? Okay.
Yeah.
Our knowledge is less specialised than a midwife. So we would do a kind of normal observations to see if any of them are out with the norm. This patient happened to have slightly raised blood pressure, which gives us concern in pregnancy. And then we're looking for the patient to advise us, is there any bleeding or whereabouts is the pain, and to kind of give us clues as to whether there's potential things that have happened to the children.
Right. The staff were, I think they were worried because it's their friend, colleague, they're concerned. The family were rocking up as well, understandably anxious. What made this job tricky was emotion. I think the lady was distraught, she's anxious. You're trying to comfort her, but you need to be careful what you're saying because, I don't know, that everyone's okay with these babies. So you have to be careful. You want to instill hope, but you don't want to be blatantly lying to somebody either. This your first?
No, second.
Second.
A wee 5-year-old lassie, so she does.
Oh, have you? Just going back to nappies, so I don't envy you there. Yeah. I've got 2 girls, 6 and 9, and my wife's talking about another one, but I thought I'd go back to it, eh? But, you know, kids they keep you young, eh? So listen, I'll take it as gentle as I can, alright? We'll get you up there. Well, your husband's going to meet you there, so the midwife's know we're coming, so we'll take good care of you, alright?
So midwives are up there waiting for us, Phoebe, okay? So they'll give you a full check over and everything. If you were to rate the pain out of 10 for me, 10 being childbirth, whereabouts are we out of 10? Really high up, are we 7, 8, 9, that kind of pain? Yeah, 7, 8, 9, okie dokie. On a journey, the main job is to try and keep the patient nice and calm and keep observing them and keeping those observations going until we get to kind of that specialist help. Because out with kind of getting scans and specialist care, there's not a whole lot we can do other than a kind of a dire emergency situation, which hopefully we don't have to cross. Just pulling it in the hospital now, so within a wee minute, that'll be us.
I've got 2 children of my own, and it's a roller coaster. A pregnancy, it really is. I remember making several trips to the hospital over a kind of 3-month period. I can empathise when I go to jobs like this. You're just worried constantly, and it's just a tough time.
As they wait for their next job to come in, Pete spots some friends.
Hello. Sitting, darling, eh? Here we go.
Wow, how cool's that?
So, when we take any children in the ambulance and they sit in the stretcher, we make them a hospital hat. Okay.
Just a nod of approval. What you did was a nice thing to do, man. Oh, it's the same. Do you know what? It's not the first time that Pete has made a hat for a kid in the back of this ambulance, I'm telling you. It's his standard go-to.
See, to be honest, it's the final thing I need to teach you, you know. I know. When we break up the next 2 months, see when you go your own way, you're not moving me until you can make an elephant.
Key paramedic, top skill, can you make a hat for a kid?
Do you know what? Sometimes
Makes a difference.
It's not always about the medicine, sometimes it's just making a kid smile when they don't feel well. There we go.
The calls that you would get here are extremely varied. You could go for having your wee elderly patients, or your UTIs, things like that, to going to a big trauma job. There's no really telling what you're going to get each day.
It's 8:30 in the morning, and the first job of the day for Chelsea and Chris.
So we've got an 80-year-old female who's fallen outside, says that she's got a hip injury, she's lying in the grass at the moment.
In Glasgow, pretty much every shift we'll go to, we'll have at least one fall. A fall for an elderly patient can be quite a life-changing event, especially if they've really injured themselves.
Hello, how are we? Hello. Good morning, what's her name?
Lydia.
Lydia, hello, my name's Chelsea.
She's so wee picture.
Hey.
It's a hip.
Do you remember what's happened, Lydia?
Yeah.
Yeah.
I'm just walking Hardy. Just a wee walk at this time.
I think she said she kind of slipped in the mud. I don't know, she said the dog maybe kind of pulled her a wee bit.
I think she was lying there for quite a while, but she
The
was
neighbours
cold.
had come out and gave her blankets and things, sure, to try and keep her warm. Have you landed on your back, Lydia, or did you land on your front or your side?
Landed on my hip first.
You've landed right in your hip. Is it your right or your left hip?
Right.
The right one. Are you sore anywhere else at all? It's just this hip? Right. So we've got you all nice and wrapped up, Lydia. But I'm just going to have a wee feel down this leg, okay? I'm going to do it nice and easy, okay? It's just to get a wee look in. You're all right. Chris is away to get you another wee blanket till we get your head up, okay?
Ma.
Can I take this wee hand?
We've got a whole water bottle, that's great.
We'll get two.
Two. We'll be roasting. We'll do a couple of wee checks and then we'll try and get you off this ground, eh?
Lydia, are you able to straighten out that left leg?
Oh, yeah.
It's okay, don't worry if you can't do it.
No, I'll do it, I'll do it.
Oh, you've managed it.
I'm going to do it.
You've managed it. How's your back and things, Lydia?
Oh, it's fine.
Fine, no pain at the bottom of your back or your neck or anything?
You're not sore here?
No.
No. You've not banged your head or anything?
Maybe it's just badly bruised.
Maybe it's just badly bruised.
I don't, the way it's lying, I don't think so.
You can feel me feeling right down this leg? Sorry.
No, but really.
So in Lydia's case, it's a severe pain, so we would kind of skip the mild and moderate painkillers, go straight to something stronger like IV morphine. Normally when we're going to give someone IV morphine, we tend to start them on a gas and air, which is called Entonox. So it's a mixture of oxygen and nitrous oxide.
Have you ever had gas in air before?
No.
No. So this is just something, maybe make you feel a wee bit lightheaded, but it should hopefully take away the pain a wee bit, okay? It's what you get, it's what ladies get when they're having babies. It can make you feel quite lightheaded, can make her feel a little bit woozy. It's not a long-lasting drug, so we use it to kind of get her by like a short period of pain.
Take big breaths for this, okay?
Okay.
You just try and bend your elbow. That's it, well done.
Nearly got it, Lydia, that's us.
Big breath, so you take big breaths for this, okay?
Okay. There we go, excellent.
I'm so sorry.
What are you apologising
don't
for?
apologise.
Don't be silly.
Last time I was in an ambulance was 35.
35 years ago. You're doing no bad then, eh? Right, I'll go and get the bed now, right?
Yep.
Now have a look at our things then. Revenge.
Oh, sorry, Lydia.
There.
Just having a wee look at your veins, okay?
They should be good.
They look good. It shows that we can hopefully get a wee cannula in there, and it means that we can give you some morphine to deal with this pain before we get you moved, okay?
That's lovely.
She was in quite a bit of agony, to be honest. So it would have been a bit horrible of us to kind of try and just scoop her and run without administering any pain relief. So it was to keep her as comfortable as possible and to keep her nice and calm and just to get her kind of sorted a wee bit. Okay, so a wee scratch coming up. Oh, Lydia, you've picked your date to have a fall outside, eh?
Isn't it vicious? Vicious.
At least it's not raining, Lydia, at least it's not raining.
Indeed.
We'll just give you this nice and slowly, okay? And sometimes it maybe make you feel a wee bit sick or a wee bit lightheaded.
How are you feeling?
Well, it must be a wee bit better because...
Is it a wee bit better?
Well, I think so because Chelsea will be digging for like...
You just grassed her. You just grassed her in.
Sorry, Lydia. What we'll do is we've got a board that we can pop you on, and then it means that we can just lift you up in this position for the most part. And we'll get you onto our trolley and get you into the ambulance.
No, you do like that.
You just need to lie there.
You don't need to do anything.
That's all you need to do, Lydia.
We've got to get you a wee... Just getting this board underneath you.
You're all right, you're all right.
See this? We need to take big breaths of this, okay? So see when that pain comes, you take big breaths, okay? You're okay, you're all right. Big breaths, big. Yeah.
No.
Big breaths, big breaths, big breaths.
No.
Seeing someone in pain is, it's never a nice experience. It's our job to try and make that pain as manageable as possible. We're kind of in a battle against time, we're outside, she's getting colder. But seeing her in pain, it's quite hard.
Especially when you know it's you that's kind of causing it by moving her. You know you're doing the right thing by getting her on that board and getting her up, but you're causing that pain at that moment in time. Lydia, your sister's here. She's here.
Look, you've got a lovely handsome man and a lovely lassie. What more could you want? Be the pair of smashers.
Pair of smashers. Other than I leaned on a leg. Big deep breaths, okay?
No. You're all right.
Big breath.
Ready?
Right, 1, 2.
Oh, I'm sorry.
That's it, done. That's it.
I'm so sorry.
Eh? No trouble at all, Lydia.
So whereabouts is the pain, Lydia? Where's the pain? Right in there?
In the righty.
In the righty. Can you straighten it for me just now then?
Yes, if you give me a horn.
If I give you a horn? Right, all right, the other one's shortened in.
I can't be broken. I would have a broken.
Lydia,
I think you've maybe broke that one, your right one, because you're in that much pain. We've got a socket joint that goes into your pelvis, and it's like a ball, and then there's a bit of bone. This part here is your neck or femur, and when that fractures, basically your leg's no longer really connected to your pelvis.
Right, so Lydia, what we're going to do is we're going to take you off of this board, okay? So you're just going to feel us moving this about, all right?
So please stop. Oh God,
I've got it.
Oh no,
that's it, Lydia.
In an elderly patient, it's a very serious fracture. It can cause a lot of, bleeding in the inside. It takes, approximately 4 to 6 months for one of the type of fractures to heal.
I'm just going to lift this just over you, okay? So you just stay nice and still. That's us. Perfect. Yeah, it wasn't that bad, was it? That's that off, okay? Is that all right? There we go. Elderly patients apologise a lot. They seem to think that by calling us or asking for help that they're being a bother. But this is our job. That is what we're here to do. Lydia, you feeling okay?
And just a bit tired.
You've done amazing here. Absolutely amazing.
Oh, can't be that sitting with you.
Absolutely not. Believe me, Lydia.
People of our generation don't really phone ambulances that often, or have throughout their life.
Very last minute.
Throughout their life, have never probably phoned an ambulance, whereas your generation, they'll phone an ambulance for pretty much anything.
There we are.
Thank you so much, babies.
You're most welcome. It's been a pleasure.
is a lovely place. Just an amazing place. In summer.
Yeah.
Winters are horrible. When I was 17, I did a year in Germany in an emergency department. And I really liked the emergency care part, but I didn't like the nursing part too much. So I just ended up with the ambulance afterwards, and I never looked back. I love it. I love my job.
Woo woo! We're going on a boat. A little mini boat. I need a boat.
Little wee boat trip.
Little wee boat trip.
Oban is the gateway to the islands off the west coast of Scotland. And if a patient falls ill on one of these islands, they will often end up in the hands of an Oban crew.
Like when did the net other be cut back?
Today, a tourist has slipped and fallen on the Isle of Mull.
Some might have a really small community hospital. It's a great small hospital, but they are limited in what they can do. So quite a lot of patients, especially if there's actually something broken, they need to come over to the mainland. And then normally a crew from here goes on the ferry over to Mull, pick up the patient and bring him back.
Okay.
Getting to Mull involves a ferry journey of just under 1 hour.
Thank you!
They're really nearly full.
I don't know.
What happened?
Not getting on.
We're not getting on?
But if the ferry is busy, it can be a tight squeeze for an ambulance.
Hi.
Yeah, we're going to move that red car. Hopefully get you in underneath that.
Good luck.
We didn't expect you, so.
Hey, we had some struggle, so we're at the end of the boat. It will take us a while to get off, what cost us some time on Mull. Can you ask the Mull crew to bring the patient to the ferry terminal, please?
Yeah, no worries, that's fine. I'll see if they can take the patient to the ferry terminal, not a problem.
In the interest of safety, passengers are advised to take extra care when going down the stairs and follow instructions from any crew members.
Compared to other areas, I think a rural area like Oban faces a lot of problems with, first of all, you're really far away from hospital often, so you're a long time with patients, you're a long time responsible for the treatment, what can be quite challenging. If there's critical care or a helicopter, you're just really far away. You have one other crew in Oban and nothing else around. What's different to city where you get a lot of resources in a short time. Good try, but you really take off your boot now.
Thank you.
So you have a lot of tourists over there just for the wildlife. We have otters, you have dolphins around on the coast. It's a really nice island to visit. I love Mull. Yeah. I would live there if I could do.
So we got this lovely lady yesterday. She's doing a wee slop, the ankle went, it was definitely dislocated. Kept her overnight and now she's been transported. Hospital's just recently given her Kenny morphine and down. She's been fasted since 6 a.m.
The patient Rita is on holiday from the West Midlands. Her bird-watching trip to Mull has taken a painful turn.
Send us a postcard. Here we go. Bye, Rita. Nice seeing you. Okay. Bye-bye. These guys will take care of you.
A lot of people that we get that have falls and anything really that we pick up usually tend to be people up on holiday that their holiday's not planned out the way I think that they'd hoped.
You all right if I move?
All right to go. We're going to Oban at the moment. Woo. I think they will do an X-ray. We have 1 hour of lovely boat driving.
Hi.
So were you hiking yesterday?
Well, yeah, we went to see the puffins. We went on the first island. That was way too steep and rocky, so I didn't go up to the top too. But then on the next one, I thought it would be much better. Till I got on there, and then I decided, no, I'm not going to go up there. and then decided to just walk back down. Maybe it was only maybe, I don't know, 3 metres high, on grass. Took 2 steps and over. Major.
Did you at least saw some puffins?
No, I've got a video my friend sent me.
So not
Not even sure if I want to see them anymore now. Everybody's been absolutely brilliant. Made me realise just how far from home I am. All the places in all the world to do this.
I like the fact that we have more time with a patient than people in the city would have, and that we care for a longer period of time for patients. But that also means if you have a really sick patient, you have a really sick patient for a long time in your bag, and it takes a lot longer for them to get to the destination where they can get the help they need, but can be quite challenging at times.
Rita will be treated at A&E in Oban before being driven south to Paisley for further treatment.
Thank you. Hello, how you doing?
So I do need to hang up now, take another call, but help has been arranged. If it becomes less awake and vomits, quickly lay him on his side, and if he does get worse in any way, call us back immediately for further instructions.
Operationally, we've got 3 shifts down in the Highlands. Grampian and Aberdeen seem to be good. No issues there at the moment, and hopefully it stays that way.
Scotland's 999 calls are handled at 3 ambulance control centres. Call handlers answer the emergency calls, and dispatchers coordinate the ambulances available for the emergencies.
Morning 4650, there's a transfer from Belford Hospital to Rigmore. As a dispatcher, you are responsible for making sure patients get their ambulances. Basically, the call handler takes the job, it's all scripted, it gives you a code, it comes onto your screen. You res it, find a suitable ambulance, and send all the information.
Okay, that's understood. Will you be treating it on scene then, or pass it on to the GP? It's just we have another job in the area, and I just wanted to double check before we get anybody else en route over.
The Highland desk, you're looking after like the most rural areas. You've got like all the little islands, and some of them, there isn't actually an ambulance on that island because it's so small. So there's a different way of doing it. There's basically like a contractor that will go to the patient, take them to a ferry, to take them to the other part of the island where there's a paramedic. But it's learning that and understanding the geography of the Highlands, I think. Inverness, you're fine, but if you go into the little places, it's hard. Yeah. But there's always someone in here that's so knowledgeable that they just know what to do like that.
So it's not too far away. It's come in as a possible stroke. So we'll maybe ask if Helimed is available as well. If it is a stroke, we'll get back to you regarding that. Over.
Is the patient awake? Okay, I'll take the details off you shortly. What's the address of the emergency?
Leona is a call handler. She is the first point of contact for the public when they're in trouble.
Okay, tell me exactly what's happened.
Today, Leona is taking a call from a nursery.
There is 4, is that correct? Has he had more than 1 fit in a row? Is he diabetic? Is he an epileptic? Does he have a history of stroke or a brain tumour? Has the twitching stopped yet? We need to find out what type of fit he's having, and quite importantly, if the seizure is still ongoing and how long he has been in seizure for. Okay. So, sorry to interrupt. Okay, is he breathing at the moment? That's great. But Weeman wasn't coming around, he was still unconscious after the seizure, which can be very common because they're quite exhausting having a seizure. It takes quite an impact on the body. If he starts to fit again, don't do resuscitations, don't hold him down or put him into his mouth and move dangerous objects away from him. How's he doing at the moment? Is he responding at all? At that age, 4-year-old, they can't tell you what's wrong, they can't tell you what hurts or if anything has happened to it, and they really are relying on an adult around them to take care of them. So is he twitching? Just let me know when he starts responding or if anything else changes with him. You're doing great, be able to get this information relayed back. We do appreciate that, thank you.
Throughout this call, Leona is sharing the information with a clinical team. They will decide whether or not an ambulance is needed.
At that point, it wasn't down as an ambulance response. I wanted to stay on the line.
But then the child's condition takes a turn for the worse.
So is he having another seizure? Okay. I can help come in as quickly as they can. Yeah, the ambulance will be coming as quickly as they can to him. You're doing great getting all this updated information for me. Really do appreciate that. Thank you. Just keep reassuring him as well that the help has been arranged for him. Because the boy went into another seizure, it ended up as quite a high priority response, so we got a crew out to him.
It will take an ambulance 30 minutes to reach the nursery.
He's vomiting. Okay, just turn him on his side. Just make sure that all the fluid drains from his mouth and nose. He might still be able to hear you, so just keep talking to him and keep reassuring him that help has been arranged, and if anything changes at all, just let me know. Help's coming to him as quickly as he can. Is there someone outside that can meet them, or is that them there? Oh, that's wonderful, thank you. They'll just be getting some equipment and things like that out that they'll need. Yeah. That's great, I'll let you go. Okay, you're welcome, take care.
Leona has been on this call for nearly an hour. But despite the tense situation, the caller has remained calm throughout.
She was fantastic. She was so calm. It was quite a lengthy call, but she didn't seem to be heightened by that at all. She was the ideal caller, I would say, for a situation like that. It's probably her job working in a nursery. She's used to chaos and children running around, but her being calm certainly helped. That would have helped keep the patient calm.
Kelly is a student technician. She has lived in Oban all her life.
Everyone knows everyone, and everyone knows a bit about everyone's business. It's quite small, tight-knit community, yeah. But it is good that everyone knows everyone, and people are willing to go that extra wee bit to kind of help each other out, because you'll always know someone that knows someone else. It can make your job easier, because you kind of know a bit about the patient already, but then sometimes it can make it difficult in high sensitive cases where they're kind of looking at you for a bit of support as well as a local rather than a ambulance employee.
Proper call, 12 stuff, just give in. What was that? Just difficulty in breathing, proper call. Agonal ineffective breathing, 85-year-old female. Don't know where the entry is though. Maybe it's still here.
A purple call is the highest emergency.
Right. What can we do for you today, my love?
I've panicked a wee bit because I couldn't get my breath. But this got out of hand today.
And you normally have some breathing problems, but today it was worse,
Yes.
was it? Yeah, okay.
But when the crew arrive, the patient, Eleanor, does not seem to be in immediate danger.
There we are.
The lady was on her bed, seemed quite out of breath. She was having breathing difficulties, but by the time we had actually got there, she'd had all her medication and seemed to be much better.
The crew still need to work out what is causing Eleanor's breathing problems.
What's the BM?
7.1.
And temperature?
And our temp is 37.8.
Yeah, she felt a little bit warm. On top of your normal medication, or do you get it new?
Tim, I don't know what you're saying, darling.
Don't worry. It's a problem many people have with my accent.
Do you understand what I'm saying? darling?
Yes, I do. I can beautifully understand you.
Oh, thank you.
It is hard for them to understand us, especially with masks. And my accent as well gets worse the louder I speak. So sometimes you just need to take off the mask so people can actually understand you, because they rely on seeing your lip movement to actually fully understand what you say. I just have a wee listen to your chest, my love, okay?
Yes, darling.
Sounds quite good. You got a wee bit of a wheeze there, but not too much.
So not, darling.
Just a little bit of a wheeze.
Right.
But not too much.
Okay.
But completing all their obs on Eleanor presents an unusual challenge.
Connecting you to all these wires, right? And I'm going to put 2 in your ankles, okay? That all right?
What ankle, please?
Both of them.
No, I've got my leg.
You've not got one. There we go, because you were hiding that. When I was doing a set of observations on her to get an ECG, it involves sometimes putting the stickies on the limbs. So when I went down to put them on her legs, I realised that she only had one leg.
Well, what's the problem with your leg?
So poison circulating foot, and it just travelled up the leg with poison or whatever. So
that's a shame.
Tried to save the knee, but they thought it was better to take the knee off. So I was just left with wee Charlie here. I feel such a fraud. There's nothing much wrong with me. Do.
No, you're fine. That's what we're here for.
Okay, darling.
Now, I'm going to have to lift up your top.
Lift it up, for goodness sake. I'm an old woman. I've been in and out of hospital.
Is that okay if I lift up?
Yes.
Now, we need you to sit nice and still for me, and I'm going to do a wee reading, okay?
I will, darling.
Although Eleanor seems stable, Tim and Kelly are concerned about observations on her heart from her ECG.
There's some damage in the heart tissue. We can see that on the ECG, and that's mostly an elevation. And if people have prior heart conditions, that will be still showing up even after years. So my advice would be to go to the hospital to get some bloods done and get them checked out if it's known or not. It's up to you, but I need to give you obviously the advice that I would advise you to go to hospital.
Very good of you, and thank you very much. I shan't be going to hospital. Right.
I thought that would be your answer.
Do you mind if I have a wee look in this bag? Is that okay?
Paramedic crews cannot force patients to go to hospital, but Tim and Kelly are still concerned.
We tried to find some background information about her.
They now need to do some detective work to build a picture of Eleanor's medical history, with the help of her husband and her son.
Have you not got a hospital there? There must be a doctor's letter there from Irish.
Some people are not fully aware about their medical history, especially if it's quite a lot. They just lose track of it, and it's really helpful to then just can look up the record and see, okay, they're on this medication, and then it helps you to figure out what could be wrong with the patient. But that's perfect. That's what we're looking for. And she's on aspirin, so I think it may be known, because that's what you normally get if you have heart problems, is aspirin. So that's a good find.
Eleanor has a prescription for aspirin for her heart condition, but her chest infection still needs treated.
So the plan would be, I would try to call NHS 24 And at least try to get some antibiotics for your chest infection then. Because I think you should get some antibiotics. I will call them, yeah.
Yeah, that's a shame, innit?
Why?
They're coming out just for that.
It's Saturday and the NHS is busy. Tim is in the queue with everyone else.
Continue to hold and we will answer your call as soon as we can.
Yeah, so I'm a paramedic on scene and I would like to talk with somebody about some antibiotics. So we still checked her through and she seems to have some crackles on the lower chest, both sides. She may have a chest infection and it may be a good idea to get her on some antibiotics before that gets worse. We got a prescription?
Very good of you, darling.
With antibiotics for the chest infection ordered, Tim and Kelly can now leave Eleanor to rest.
Okay.
I don't want the hospital.
I think so.
I'm not a dramatic soul at all.
No.
I don't look for that drama, Kelly.
No.
I like a track, I like a laugh. That's more me than this. There's all this. But anyway, it's happened and that's it. That's it.
You seem to be doing well with it though.
Yes, psychologically I am too. That's the most important thing. And if I get my bloody teeth, I'll be all right.
If you could, just have all this paperwork close to you and all together. So if ever an ambulance comes again, we can look it up. It is really important that if people have records from GP appointments, to have them available for the ambulance service, because looking at old paperwork, old ECGs is really helpful for a diagnostic. The patient is quite complex. It's not just the 5 minutes you're there, but things that happened before. So it's helpful to know what's going on. All the best. It was a pleasure to meet you.
Oh, I'm glad. It's a pleasure. Pleasure to meet you too.
You're like referred?
Yes.
She didn't want to go to hospital, did she?
No, she don't want to go to hospital. But it's understandable. She was there the whole time with her leg. Should be alright. What do you say? Another life saved.